that's really the problem. In our food processing, we drop the potassium and raise the sodium. We even do that with salt itself. If you buy unrefined sea salt, it's sort of gray in character that you have to pay a lot more money for it. But it actually has potassium salts in it with sodium. But if you get regular salt, industry has removed the potassium and the magnesium and the calcium salts and only give you sodium chloride. And that is more predictive of high blood pressure than sea salt. If you take unrefined sea salt, it doesn't raise your blood pressure as much as the refined salt that most of us use. That's true in our foods as well. We refine them, we take out the potassium. When you use white flour, you've taken out a lot of the potassium out of the grain. Grain is normally fairly high in potassium, not as high as some of the other foods.
Like bananas.
Like bananas. Bananas are very high in potassium. Squash is high in potassium. Potatoes are high in potassium. Beans are high in potassium. And if we kept the salt when we ate beans and potatoes low, they'd be a wonderful food for high blood pressure. Celery is an excellent food for preventing high blood pressure, even though it has quite a lot of salt in it, because celery has a natural diuretic effect and helps lower the blood pressure. Pears are excellent for lowering your blood pressure as well. Mushrooms are high in potassium. Prunes are high in potassium. Raisins are high in potassium. Kiwis are high in potassium. Almost all fruits are except apples, but apples have another positive effect. They tend to be diuretic, and so they lower your blood pressure as well.
Interesting. So we need to decrease the amount of salt that we're using, and what I've heard you say is that sea salt perhaps would be preferable over regular salt because of the potassium.
Yes, that's true if it's unrefined. If you take sea salt and take out all the potassium salts and the magnesium salts and the calcium salts, both magnesium and calcium, by the way, can help lower your blood pressure. And if you take those out and call it sea salt, it's not going to help you anymore, even though it came from the sea. What you want is the unrefined. There was a study done in British Journal of Medicine some years ago now where they used a balanced salt and found that it actually didn't raise blood pressure at all. That wasn't sea salt, but it was similar. I'm not going to say that sea salt won't raise your blood pressure at all, but it seems to be better for us than the regular. The real key is not with what salt you use, but to minimize salt and raise the potassium in our diets. We found that you can even supplement potassium in place of a blood pressure medicine, and that too will lower the blood pressure.
Which brings me to medication for blood pressure. It seems these days it's hard to find someone who's not on a blood pressure lowering medication. Are those medications safe? Are they the best thing to do? Or would there potentially be some other more natural methods that we could use to lower our blood pressure?
The most important thing, Cheryl, is to normalize your blood pressure. And it may be that you need medication at first while you're changing your lifestyle to bring your blood pressure down. Some people, even with the best lifestyle, cannot lower their blood pressure to normal because of stressors in their life, because of heredity. Lower your blood pressure by whatever means necessary. Remember, a normal blood pressure is critically important. People don't realize how important it is, but for every 2 points that your systolic blood pressure exceeds 120, your risk of stroke goes up 15%, and your risk of heart attack goes up 10%. Which means if your blood pressure is 140 systolic, your risk of having a heart attack has gone up by 100%, and your risk of having a stroke has gone up by 150%. Lower your blood pressure. If you need medication, use it. There's some very good medicines. But I would say minimize the use of medicine because there is no free lunch. These medicines don't make us feel better. They will help us live longer. But if I use them, usually what happens is I either decrease the blood volume, or I decrease the blood flow, or I dilate the blood vessel. In every case, I decrease performance of the person. That is to say, blood pressure medicine generally makes you tired, and it makes you less able to perform work. In men, it causes impotence, and that can be a problem as well. Minimize your use of medicine through regular exercise, through weight loss like we talked about, through increasing your potassium intake, reducing your sodium intake. All of those are very important. Also, getting enough sleep will lower your blood pressure.
Really?
It will. If you are sleep deprived, you are insulin resistant. Remember I said if your insulin level is high, your blood pressure is going to be high. There's a condition called sleep apnea where people snore a lot and then stop breathing at night. That alone causes high blood pressure. And sometimes if you have sleep apnea, what I need to do is not put you on medicine, but correct the sleep apnea through proper means. You need to be tested for it. Fortunately, in this community, we have 2 sleep labs. Parkview Hospital has an excellent sleep lab. So does Midcoast. You can be tested for sleep apnea. Maybe you don't need a medication. You need that corrected, and then your blood pressure problem will go away. That would be far preferable to having the problem and not correcting it. Minimize your use of medicine, but take it if you need it, because high blood pressure is deadly.